All right, well, we are right at 12 o'clock p.m. I want to thank everyone for joining us, and I know we may still have some more students that log on, but I want to be mindful of everyone's time. So we're going to go ahead and get started. Thank you so much to our panelists. How we're going to do this is we have questions that we're going to ask each of our panelists, and that will take place during the first hour. And the second hour, our students will have an opportunity to be in a breakout room with whatever or whichever panelist they would like to speak to and ask some questions directly. So again, thank you for your time. Let's get started. What I'll first start by doing is just letting everyone know who is here. So we have representing the University of Maryland School of Pharmacy, Dr. Cherokee Layson-Wolf, who is the Associate Dean of Student Affairs. We have from the George Washington University, Ashley Ewing, who is an admission coordinator for the George Washington Department of Physical Therapy program. We have from the University of Maryland, Baltimore, Karen Frank, who is the Assistant Director of Admissions. We have from Case Western Reserve University, Elizabeth Pykush, Manager of Administrative Operations. We have two representatives from Notre Dame of Maryland University, Peter Scanlon, who is the Associate Vice President of Enrollment Management, and we also have Natalie Cross, an admissions counselor. And we also have, last but definitely not least, from the University of Maryland School of Nursing, Dr. Lori Edwards, Associate Dean, the Master of Science in Nursing program. So again, to our panelists, thank you so much for participating in this. And so what we're going to do with these questions, we're going to do like a little round robin format. So I'm going to ask the question and then each panelist will get an opportunity to answer the question. The first question, we'll start off with Dr. Lori Edwards from the University of Maryland School of Nursing Master's Program. I'd like to ask you, Lori, what makes your program unique?
Thank you for this opportunity. And I would say that the program that's unique that we're offering at University of Maryland School of Nursing is that individuals who are interested in the profession of nursing can actually, particularly if they have a previous bachelor's degree, can enter into the profession and get a master's education while they're getting their entry into nursing practice degree. And so that's one of the unique features about this particular degree. At the University of Maryland School of Nursing, we do also offer the Bachelor's of Science in Nursing degree as well. But those who have a previous degree can enter into the profession with this master's education, which really launches people's careers quickly.
All right, thank you so much. Same question for Peter from the Notre Dame of Maryland University, the OT program. What makes your program unique?
Yeah, thank you, Erica. So we are the newest OTD or occupational therapy program. It is a doctorate entry-level program in the state. So we're welcoming our third class this coming fall, which is very exciting. Obviously, since we are a new program, we have brand new facilities, which are state of the art and were built custom just to accommodate those occupational therapy students. So the labs are really something to see, and you know, our students love them. Because we're a newer program, we are a smaller program still. So you're going to have smaller class sizes, just like many of the other programs at NDMU. Lots of personalized attention. And everyone, and I do mean everyone, on the faculty side, including the director, is very involved in the program, teaching, working with students, mentoring them. So it is a very much hands-on experience with all of our wonderful faculty as well.
All right, thank you so much. Same question for Case Western Reserve University. This is Elizabeth Pykush representing the Anesthesiologist Assistant Program. If you could tell us, please, what makes your program unique?
Sure. So our program is 2 years, and the really unique thing about our program is that within the first month of the program, the students are in clinicals. So the first kind of week that they are in clinicals, it is a bit more of that observation, shadowing experience. But by your second month of the program, you are in the clinical experience and you are getting the opportunity to try out things that you're learning in our simulation environment. So that's a really big benefit for our students that they really enjoy because they get to be right in and starting kind of practicing what they're learning, which is great for them.
Awesome. Thank you so much. All right. So Karen Frank, representing the PA program at the University of Maryland, Baltimore, if you
Thanks
could tell
so
us
much.
what makes.
Thanks so much. I also noticed that Shawnee Fleming is also on the call, and she's from our PA
Oh,
program as well. So I
okay.
just wanted to make sure she can participate. The PA program resides in the Graduate School, one of the 7 schools that are on the UMB Medical Campus in Baltimore, along with the UMB School of Nursing. So we're able to do interprofessional education experiences with all of those other schools, which we find is really a unique perspective. UMB leadership is very supportive of our programs, excuse me, and all of the opportunities for education. Our faculty and staff are innovative and truly care about our students. We've just recently moved to the campus at University of Maryland, Baltimore, and we are finding our footing and we are growing, and it's certainly an exciting time to be part of this program.
All right. Thank you so much.
Mm-hmm.
And now we'll go to Ashley Ewing, representing the DPT program at George Washington University. If you could tell us, please, what makes your program unique?
Well, thank you for having me, as everybody echoed. I think one of the main things that makes our DPT program, our Doctor of Physical Therapy program, unique is our relationship to the APTA program, so the Association of Physical Therapists. We are located in Foggy Bottom in DC, so right downtown in DC. Many of our faculty members are part of the APTA boards, and we are very big on not only volunteering, but also advocacy. So our students routinely go on the Hill to advocate for individuals with disabilities. We work closely with the other programs at GW and in the medical school, including PA, OT, nursing, and such. And I think that really makes our program unique because it's not just learning, but it's also how to advocate for the patients that you're seeing in the hospital and throughout your career. So we are very big on all those things. We work very closely with the APTA and encourage that relationship with our students. And then again, I think I can echo everybody's statements or sentiments in that all of our faculty really care about the program, the students. The program is smaller, so we only have about 46 per cohort. So you really get to know your faculty members, you really get to know the best of your peers, and that creates lasting memories and lasting relationships throughout your career once you graduate.
All right, thank you. And Dr. Layson Wolf, representing the University of Maryland School of Pharmacy, could you please tell us what makes your program unique?
Good afternoon, everybody. Glad to share this stage with everyone. And so I represent the University of Maryland School of Pharmacy in our Doctor of Pharmacy program. One of the things that makes our program unique is that we really encourage our students to be entrepreneurial in how they approach pharmacy. We have a pathway at our school called Pharmapreneurship, and it's really a different way to kind of think about pharmacy. Everybody's very familiar with your community pharmacist, and that's the primary area where I do most of my work and teach our students. And also hospital pharmacy, but there's actually over 100 careers for pharmacists out there. And so I think what's really critical is once students start to be in our program is that they get to see all the different opportunities where they can practice as a pharmacist in a variety of different settings. And so through our various pathways, our various dual degrees, our students are really able to kind of really craft their own niche in pharmacy. And so we're really proud of those opportunities for our students. I think it's great to really kind of open our students' minds with regard to the opportunities because most of them have practiced in community, some have practiced in hospital and haven't had that opportunity to really do that deep exploration. And we're really able to take them into those directions when they join our program.
All right, thank you so much, all of you, for the answers to these questions. So now we'll have our next question, and this time we'll start with Peter, representing Notre Dame. What does a competitive applicant look like?
Sure, and this is a great question. Obviously, we look for strong academic background. The OT program welcomes students from any bachelor degree background, right? Regardless of what your undergrad major was, you are welcome to pursue applying and hopefully getting admitted to the program. But what comes with that is quite a lot of prerequisites. And so in the case of looking for the strongest applicant, we also want to see very strong academic success in those prerequisites. And the more recent, the better for us, right? So meaning that if someone took anatomy and physiology 1 and 2 20 years ago, obviously we would need you to take something a little more recent, right? So recent success in those prerequisites is very helpful to applicants. It's something we really look for. There are some clinical hour requirements as well, shadowing experiences. We're looking for varied experiences there. We pay very close attention to the type of people that you shadow and the setting. And so the more experience you can bring through those hours, the better for us. Because this is a generalist program, and students are being taught to work in any number of OT settings, right? I'd also say that, we are a faith-based institution. We have a very strong mission that flows through everything we do. The OT program very much ties into our mission in serving others. And so we want to see a commitment not just to the university's mission, but the program's mission, and really a commitment and a dedication to, truly working with and helping the patients that our students would encounter, whether it's in the program or after they graduate and enter the field as a professional.
All right, thank you so much. From Case Western, representing anesthesiologist assistant, could you please tell us what does a competitive applicant look like for you, Elizabeth?
So similar to what Pete was saying, we definitely look for the academics. We look for the, MCAT or GRE, and we also look at your grades. But one thing we really look for is somebody who is well-rounded. We look holistically at the application, so we're not just looking for any one thing. And we find it really beneficial for people to share their outside interests as well. So if you have a passion for guitar, or you love to do horseback riding, or there's something else outside of just a science or an academic focus, we do really value that as well, because we kind of look at it as an additional bonus to your application. So we do look for kind of outside experiences. If you have volunteer hours as well, even if they're not necessarily within a healthcare focus, we really like to see students holistically as an all-encompassing person, not just grades and academics.
All right, thank you. So the same question for the University of Maryland, Baltimore, representing the PA program, Karen or Shawnee, whichever one wants to answer this. What does a competitive applicant look like?
Sure. Our application process is administered through CASPA, and our applicants must meet all of our admission requirements. There's a cumulative GPA 3.0. You have to, there are prerequisites that need to be completed. On average, our applicants are very strong academically. They also are able to show patient contact experience. Examples of that would be medical assisting, certified nursing assistants, EMTs. All of that information is processed through CASPA and included on their application. Like Lizzie, we do a very holistic approach to our application review, which I think has really turned our program into something that we were able to produce some very stellar PAs. We look at personal statements. The personal statement prompt for CASPA is, why do you want to be a PA? And that information is very important. We're able, after reading a strong statement, we're able to get a really good sense of why the applicant not only wants to be in the healthcare field, what about PA interests them, You know, how will becoming a PA satisfy, you know, their values and where they want their career to take them. So that is, you know, that's kind of what we're looking for as far as a competitive applicant. We do a not only do we do our applications through CASPA, we also do an interview process. We're able to have some one-on-one time with the applicants. So, you know, using all of that information, we're able to make selection. And like I said, we have some very, very strong students in our program.
All right, thank you so much. Next, we will hear from Ashley Ewing, please, to talk about the DPT program and what a competitive applicant looks like for physical therapy at GW.
Yeah, so similar to what everybody said, we are looking for good academics. There are some prerequisites that we require as well. There's about a total of 12, and I think you'll find that standard. These are all great programs, and you know everybody has minimum GPAs and whatnot that they need to meet. Like Karen, we have an interview process. So you apply through our centralized application system, which is PTCAS, which you'll find with most PT schools, excuse me. I'm changing careers apparently all of a sudden. With most PT schools, they use the PTCAS application. And then once students come in for their interview, that is a big key component of the process, right? We've read your application, we know what your grades are, we know that you met the prerequisites because we've set those standards, right? But we want to meet you in person or virtually, obviously, as the last couple of years have made us do. But we want to know more about why you want to become a physical therapist, what is prompting you to do this, and if you've had any life experience that have made you go into this career field. And that's really important to us because we want to know that you have a passion for the field, that you potentially aren't locked into one particular thing. A lot of students will say, I want to be a children's physical therapist, or I want to do outpatient, inpatient, and very quickly find out that that's not what they necessarily want to do once they get exposure to the different opportunities. So that interview process is really something that we strive to make kind of interpersonal, right? We want to know more about you and not just what's on paper. And that's what can make you stand out outside of your application. Your personal statement as well, sorry, I'm taking up a little too much time, but your personal statement as well, you know, gives us a little bit of an insight to that, but nothing is like talking to the person face on face to determine, you know, what they have to say about their background and how it all comes together for them to get to this point.
All right, thank you so much. And next we will hear from Dr. Layson Wolf. Same question for the University of Maryland School of Pharmacy. What does a competitive applicant look like?
The other programs, we certainly take a holistic look at all of our applicants. And so we're certainly looking for folks that are well-rounded, strong academically, but also have a service mind. Interestingly, we don't necessarily have a requirement that they have experience in pharmacy, but any sort of work experience also certainly contributes, especially if you're more in the customer service area. I think in pharmacy, we're very customer service oriented, be it if it's working with patients or healthcare providers or care providers, those types of things. A lot of those skill sets really transfer into our program. Having said that, I think Pete might have said that when he was talking, that we have a lot of different folks from different backgrounds. So it isn't just biochemistry, chemistry, you know, degrees. We have a lot of engineers that come to our programs. We've had aerospace engineers before, but a lot of other backgrounds, as long as they are also meeting our prerequisites, which are obviously heavy in the sciences, mainly because that is the basis for pharmacy. So looking for well-rounded, looking for motivations for pharmacy, and really looking for that kind of that service mindset among our candidates.
Right, thank you. And from University of Maryland School of Nursing, Dr. Lori Edwards, if you could please tell us, what does a competitive applicant look like?
Sure. Similar to others, we do have a holistic admissions process. We do look at applicants with a higher GPA, as well as a competitive applicant has a higher GPA, particularly in the sciences and the prerequisites. There are a list of prerequisites, like others have said, anatomy and physiology is really important. And so the more recent for that, that's a stronger applicant as well. But with that holistic admissions process, we offer for the applicants who may not have as high of a GPA as we require, we offer this opportunity to write a second essay to state what about their academic background might have been challenging and how they have demonstrated success at this phase of their career. And again, this is part of those applicants who are second degree. So we want to hear why people want to be a nurse and how they envision being a nurse and really making an impact in the nursing profession as well. So that holistic process is really an important aspect of what we want to offer with that individualized admissions approach.
Great, thank you so much. So now we'll get to our third question, and this time we will start with Lizzie Pykush, representing anesthesiologist assistant. And I will ask this question of everyone, of course, but if you could start us off, please, and let us know what are some surprising things that you can do with this degree?
So I think the most surprising thing that you can do with a CAA degree is have a really good work-life balance. That's one thing that a lot of our students and our practicing CAAs really enjoy, is being able to kind of have a slightly more flexible schedule. They have the ability to still choose kind of if they want to work late, or if they want to work on weekends, or if they don't, or they have the ability to take time off. So that's a huge benefit for them. And they also are really involved still within our program. So many of our graduates are still involved with our program by either being preceptors or instructors. They are mentors to a lot of our students, and they're also really involved with local groups. A lot of them are involved with our local DC chapters of our anesthesiology assistant groups, and they're also involved with legislation. So if that's something that is interesting to you, we have that opportunity as well to kind of continue to endorse and to advocate for the profession in the various states across the country.
Thank you. Before I go to the next person, Lizzie, just in case some of our students are not sure what it is, could you tell what a preceptor is?
Sure. A preceptor is somebody who works with the students in the hospital. They could be also already practicing CAA, or they might be a physician that works with them and guides them through while they're doing their clinical experience. So they're either helping them, or they're giving the students the opportunity to try something out and monitoring them as they are working in the hospital.
All right, thank you. Next person I'd like to hear from, please, from the University of Maryland, Baltimore's PA program, Aaron or Shawnee, if you could tell me or tell us what are some surprising things that you can do with this degree. Thank you, Lizzie.
Hi, thank you for inviting us. So again, I'm Shawnee Fleming. I am a practicing PA. I've been a PA for over 20 years. And we are one of 3 medical providers who can prescribe. And what's really surprising about our profession, which makes it a little bit different, is that we have the capability of shifting specialties without having to restart school. So we are trained as generalists. So we get trained in OBGYN, we get trained in surgery, we get trained in internal medicine, pediatrics, and so we get trained the first 2.5, the 2 years of our training, and then once we graduate, we can shift between specialties. So throughout my 20 years, I've worked in pediatrics, I worked in infectious disease, I worked in research, I worked in education, and I don't have to necessarily go back to school to get any additional training, because we receive a generalist training from the very beginning, which is a bit different than our medical doctor and nurse practitioner colleagues.
All right, thank you so much. So next, I'd like to ask that question, Ashley from GW and PT. What are some surprising things that you can do with this degree?
Yeah, so I think one of the things that I personally didn't even realize before I started working for GWDPT was that, you know, you think of physical therapists and you think of the same, like you go in for a couple of weeks, they move your legs a little bit, they may move your arms, and then that's it. And I think being here has really exposed me to all the opportunities that PTs can do, and just the fact that it's definitely a field of medicine that is expanding tremendously. So working with not only just, you know, the traditional, like, I feel like I always thought of PTs as like working with older folks or working when you had an injury. And realistically, it spans the gamut of working with that population as well, but also working with children, working with mothers. There's a big push for maternity PT and women's PT in general, with working with your pelvic muscles and stuff of that nature. And the field is fast growing. So I think that's one surprising thing that people can do with this degree. We're also sorry, we're also doing a lot of stuff with technology, right? And it's something that I personally didn't think about when you think about the human body and how it works and whatnot. But from a physical therapist perspective, it's, you know, looking at vertigo and how virtual reality might impact vertigo and can help people with vertigo, using more manipulations and electronic aspects to amputees and stuff of that nature. So there's a whole world out there that PT is just only now touching, that some other fields have touched a long time ago. But as people were looking for more holistic healthcare and things, not quick fixes, it's really opening up and really spreading out to the PT field and what they're doing and what they're researching currently.
All right, thank you. So same question for Dr. Layson Wolf representing University of Maryland School of Pharmacy. What are some surprising things that you can do with this degree?
Sure. So one thing I did want to share, and it seems similar to some of my other colleagues that they've said, is that a lot of their students go and advocate for their profession. I think it's really important that we share with others what our different capabilities are as pharmacists. And in the introduction, I mentioned that I actually have a list of over 100 roles that pharmacists can play. And so some of the interesting ones, like I mentioned, you know, people are in community and hospital, that's kind of, I always call the tip of the iceberg of pharmacy with regard to what it is that we can do in the profession. We have colleagues that work with the Public Health Service, with the FDA. We have data scientists within pharmacy. We have folks that work in industry where they're dealing with pharmacovigilance. They might be working in marketing and health communications. We also obviously have folks, I'm a pharmacist by training, but I'm an academician. So I've been in academia for over 20 years at this point. So this is another opportunity for folks to explore in pharmacy. And one of my colleagues actually that I graduated with, she was one of the first pharmacists hired by NASA, and so runs their ambulatory care clinics within NASA and works with all the astronauts before they go up on missions. And so I always think of that as just a great example of all the different spaces that pharmacists could be in. And so if it's something that you would even dream about, it's probably a place where our practitioners are. And my colleague from the PA program, I think they were talking about the different areas that she's practiced in. So we also have pharmacists that are pediatric pharmacists, oncology, transplant, infectious disease. I might have already said that one, but we also have poison control. We have nuclear, we have cardiology. Like really, it's sky's the limit with regard to all the different opportunities in pharmacy.
All right, thank you. And from the School of Nursing, Dr. Edwards, could you please tell us what are some surprising things that you can do with this degree?
I love this question, and it gives me food for thought for a number of reasons. It's great to hear everyone else's responses. I think the one thing that's often confusing about the profession of nursing is people perceive it as a nurse is only working in a hospital setting. And so that's so not true. There are nurses everywhere, especially these days when everyone's talking about how we have to address health inequities and look at the social determinants of health. I would say nurses are some of the best professions to be in that role to really address those root causes in a variety of ways. So we see nurses who work in hospitals and healthcare settings for sure, many. But nurses also work in workplaces. Occupational health nursing is a specialty role. Nurses work in schools. Nurses work in public health settings and community centers, as well as the general public health system. They're everywhere. And that's what's exciting about the profession. The particular programs that we have both at the entry-level bachelor's degree and the entry-level master's degree, those with the master's degree also excel quickly, which is surprising, to become in leadership roles. So nurses are leaders in healthcare settings and in other just general settings. And then nurses are, again, like at the bedside. We have nurse managers to flight nurses. And so it's surprising to see all the different places nurses can be and work and really have an impact on healthcare.
All right, thank you. And from NDM, Peter, if you could tell us, what are some surprising things that you can do with this degree of being an OT?
Sure, absolutely. Similar to the PA program that we heard about a little earlier, it is a generalist program, meaning, our students are taught to work in any wide variety of settings and applications within occupational therapy. So with that in mind, there's a almost endless list of public and private practices and applications where our OT students will go out to work, right? Whether it's a medical facility, community center, public school, private school, could be any number of any of those settings. A lot of our students really appreciate and seek out in-home care because it's such a different patient experience to work with patients in their own home where there's a comfort level, and especially helping them to regain whether it's mobility or whatever the case may be, the specific occupational therapy application that's in practice there. One of the ones that I think, I'll tell you, I had no idea that this position even existed before working with OT students, is an ergonomic consultant, which is exactly what it sounds like, and something that I know I spoke with our director about is certainly a niche field, but one that continues to grow. So I found that one very interesting, and of course, as a doctoral degree in an allied health field, students have the option, especially once they have some experience, of creating their own practice, right? And then modeling that to what they think is most appropriate based on the patients they want to work with or what they feel their community may need.
Awesome, thank you so much. All right, so now we are going to get to our next question, and we'll start with our friends from the PA program, either Karen or Shawnee. If you could answer this question, what personal characteristics does someone need to be in this field, and what characteristics are non-starters?
Karen, I can start with this one as well. When we're thinking about someone who will excel or succeed in this field, I think that, words, the characteristics that come to mind are compassion, empathy, passionate, service. I mean, it's a serving profession. The goal, I think, of all of us here is around health equity. So that has to be something that rings true and has to be a passion for you. I think that non-starters or what was it, a non-starter or
Yes.
Okay. So non-starters are if you are not collaborative, if you don't want to work in a team, if you really are not, if service is not your thing, customer service. I mean, I think that one of the, people don't think about it, but we are in the service industry and folks come to us when they are in pain and when they're sick. And so we have to have a level of customer service and empathy and building rapport and building trust within our patients. So those are some of the personal characteristics I think could help folks succeed within our field.
All right, thank you.
Sure. Could
Go
I
ahead.
add just a couple things too.
Sure.
Thank you, Shawnee. Just to be flexible, you know, and to be a lifelong learner. Medicine is changing all the time, and I think that's really important to open yourself up to. Also, you know, just to be able to kind of, like Shawnee said, collaboration is key with being a PA. So. Non-starters, like she said, you know, unprofessional behaviors, not wanting to or not being able to connect with patients and feel that empathy, that's would be a non-starter, I would think.
Okay, thank you so much. Next, we'll ask the same question from Ashley with the DPT program at GW. What personal characteristics does someone need to be in this field, and what characteristics are non-starters?
Sorry, I couldn't find my mute for a second. I think some good characters. I think I echo everything that was just said, and I think we probably all kind of echo those same sentiments. You, as a PT, you really want to be focused on your patient and providing patient advocacy. Some of the different, you're working as part of a medical team and being able to collaborate and clearly communicate also what a patient is feeling and what they're telling you across the different, and you know, also kind of, if translating it, if you will, of what they're here, what they're feeling, and what other doctors are saying, and what is coming across in their charts, and what that is something that's very important. So you have to be willing to communicate. You have to be flexible. You have to be customer service focused, just like everybody else kind of said already. I think a non-starter would be somebody that does not want to push the envelope. As you mentioned, the medical field is an ever-changing field, and it's ever-changing, growing. And if you are not somebody that is interested in kind of pushing the envelope and really seeing how far you can go in this profession, that's something that's definitely going to be a non-starter. I would say in any hospital, right? Because you have to be flexible. You have to be willing to get up with the new technologies. You have to be a lifelong learner and learn the new technologies and see how they can be implemented for your patients and for your profession. So those are two things I think will, you know, can benefit you or not benefit you, depending on how you look at it, as you're thinking about PT, but any of these professions.
All right, thank you. And the same question for Dr. Layson Wolf, representing pharmacy. What personal characteristics does someone need to be in this field, and what characteristics are non-starters?
My colleagues prior to me, very similar themes with regard to empathy, very customer service oriented or service oriented just in general. But I would say for the field of pharmacy, one of the areas that people really need to think about are ways to be innovative ways to provide patient care services, right? Thinking beyond what it is that we typically do on a day-to-day for our patients. Generally, we think, you know, pharmacists provide medications, right? But we provide way more than that. Through COVID and everything, you saw pharmacists really come to the forefront, do point of care testing, do vaccinations. And so we were able to, you know, work with our health professions colleagues to really provide that out there into that space. But I think it was just a great way for the public and other stakeholders to really see what it is that we can do as pharmacists. And so really thinking that, taking that mindset and kind of carrying it forward, building upon our expertise as medication experts, how can we support people in their healthcare, and working with our other healthcare provider team members to really think about the holistic approach to the patient, that it isn't just one provider to one patient, that it takes a whole team of us to really make sure that our patients stay healthy. And so I'd like to keep, you know, my students, it's really important that they maintain that mindset to understand what their role is in healthcare. The other component that I think, like I said, is non-starters and probably similar to others, is somebody who's just very kind of like tunnel vision, you know, that I totally appreciate that there's a space in pharmacy for everybody in terms of the scope of work that they want. But at the very minimum, I want my students and also pharmacists to be supportive of each other, depending on the spaces that we choose to be in, right? No matter what it is that we do. So I think somebody mentioned earlier, kind of like that team mentality, and that we're all in this together, right? When I always tell my students, when you're in a professional school, you've done the hard work to get in here. Now it's all about being in here and being in here together and supporting each other as colleagues, because we're all going to be colleagues once they graduate. And so it's really continuing to push forward that mindset.
Awesome, thank you. Same question for Dr. Edwards, representing nursing. What personal characteristics does someone need to be in this field, and what characteristics are non-starters?
One of the thoughts that I had as I contemplated this question is I think for those who want to be in nursing, the series Call of the Midwives just says so much about the characters of nurses and what it takes to be a nurse. There are so many aspects to this, but really this willingness to care for people who are in a vulnerable experience, a sense of compassion, a sense of service, similar to what others have said. I would also add that a strong leadership component, and often my students say, oh, I'm not a leader, I don't want to be a leader, but I think of this in this way. When you walk into a person's room, a patient's room, walking into an experience with a family, they're expecting us as nurses to be leading them forward in that situation. So that small ounce of leadership goes a long way, because that leadership means that we have to learn to advocate for that individual and that experience. And as the most trusted profession, nursing, there is an expectation that we will help facilitate and lead that individual through that experience. I think the non-starters are, as others have said, not being collaborative, not being customer service oriented. Sometimes people will say, I don't want to work in a hospital, I can't deal with sick people. And for those nurses who say that, I say that's okay, but you still have to deal with that at some point, even in the nursing education experience. You still have to encounter sick people in a hospital. There are those who never work in a hospital who are nurses, but at some point they just have to have that little bit of experience in the hospital setting to get through nursing school. So they still have to have that willingness to be in that space. And so I think just really, again, like others said, finally, that whole aspect, if you're not a lifelong learner, probably nursing isn't for you, because it does require that lifelong commitment to learning and experiencing and getting to know how to do this work.
Thank you. And from NDM, Peter, if you could let us know what personal characteristics does someone need to be in the OT field, and what characteristics are non-starters?
Sure, thank you. So a lot of the ones that have already been mentioned hold true for OT as well. But I think the ideal candidate is someone that's going to be compassionate, and feel empathy for their patients, because you encounter such a wide variety of different patients in different settings, right? Strong listening skills are critical, right? You're working directly with your patients, in most cases one-on-one. So those listening skills are key. The dedication to helping improve patient experience and patient lives is paramount as well. I think the collaboration piece, even though a lot of the settings would be one-on-one with the patient, collaboration is key, in a lot of different settings for OT as well. Non-starters, inflexible or inflexibility would certainly be a problem. Again, you are going to encounter an amazingly wide variety of patients, and attitudes and perspectives. So it's very important that you bring flexibility to your work, try and meet your patients where they are. Competitive or argumentative, it would be a problem in this area as well, for the same reason I just mentioned. In a similar vein, anyone that would be impatient, you need to bring a wealth of patience to your patients, for lack of a better term. So those are the ones that I would highlight, in addition to some of the other ones that have been mentioned.
All right, thank you so much. And Lizzie, representing the anesthesiologist assistant program at Case Western, same question for you. What personal characteristics does someone need to be in this field, and what characteristics are non-starters?
I would again agree with what everyone has already stated, of just having a lot of caring and compassion, especially for your patients, but also for yourself and your work. We really look for people that are dedicated to the field and that are driven, and that are able to help really work in a team, because you are part of an anesthesia care team. So if you're not able to collaborate, if you're not able to work with others, then that could be a big challenge. And also flexibility is one thing too that we really look for. And as a non-starter, I would say not having a willingness to learn from your mistakes. That would be an issue if you know, didn't want to continue to learn and try new things. And also being detail oriented is also something that can be really beneficial, especially if you're working in a hospital setting with, you know, lots of different drugs, or, you know, lots of different types of situations and things. So being detail oriented would also be a helpful characteristic to have.
All right, thank you all for answering that question. So this is actually our last question that we're going to have, and then afterwards we'll go into breakout rooms and there'll be information on how to do that. And the reason that I put this question out to our panelists is because very often I get this question from my students, and sometimes they believe me, sometimes they don't. So I thought, you know what, this is going to be great to hear directly from these program representatives. So here's the question, and we'll start with Ashley representing GW's DPT program. Is it really okay to have any major to pursue this pathway?
Yes. It is really okay to have any major. It's definitely something that enriches the field, having people from different perspectives, and enriches your learning, having people from different perspectives and backgrounds, and experts in different different subjects. So it is absolutely fine. We have the prerequisites there just for that. So if you're a standard major that we get is a kinesiology or exercise physiology, and we add those prerequisites for those individuals that maybe were chemistry majors or biology majors and are now interested in PT. So they kind of get the full basis and the full background, excuse me, on you know, what you'll need to excel in PT school. So yes, it's completely fine. We welcome it, right? We want that type of experience. That's how the field grows, and that's how the program grows.
All right, thank you so much. And that same question for Dr. Layson Wolf representing pharmacy. Is it really okay to have any major?
Similar to the previous response, I think we certainly value diversity among our student backgrounds. I think it's the best way to kind of build empathy for each other and the patients that we will serve in the future. And not to mention, like I said, you know, most of our students are obviously science focused, but there's that opportunity for creativity as well to bring that in. And one thing I'll share is that I think a lot of people are very familiar with you know, backgrounds like medicine and dentistry and things like that. And pharmacy may not have been as frequent as a discussion point, right? When people are really considering what are these different options that they want in healthcare. And so I think that this is a real opportunity for folks who may be thinking along those lines, going, okay, pharmacy is another area where you're working with medications, you're working with patients, and really seeing the various opportunities that you can do within pharmacy to be able to serve in a variety of different ways. So I think it's good to kind of have those open mindsets. And honestly, you know, we have clearly we have our students who wanted to go into pharmacy ever since they were in high school. I'm one of those people. But we also have people who were in undergrad who were kind of either thinking that they were going down the med school route, dental school route, even PT, and going, you know what, I never even thought about pharmacy. I don't have any pharmacists in my family. haven't had anybody had an opportunity to kind of engage with anybody in that space. And so, and to be honest, my mother's a nurse. I'm from a family full of nurses, and when my mom was advising me on what different opportunities were, she's the one that brought pharmacy to me. And so I think that this is a great space to explore these different options. And as students are going through their undergrad and really thinking about their next steps, you know, the next year planning, especially since course registration is happening right now, you know, what are those opportunities that, hey, these spaces like pharmacy that I hadn't thought about before. So, you know, that's why I would say it's really opportunity for anybody, you know, from any backgrounds, as long as you get our prerequisites in, you know, to really pursue this area and the study of pharmacy.
Awesome, thank you. And same question for Dr. Edwards representing the nursing program. Is it really okay to have any major and pursue this pathway?
The answer is yes. And it's also yes, and because it's exciting for me to have people with a variety of backgrounds that enter into the profession of nursing. The profession of nursing needs that. We value the innovative ways people have learned before or had other careers who then now come into nursing. So, majors in liberal arts, business, language, history, teaching, horseback riding, we've had that range. And I believe and know that and have witnessed that range of previous background and education really does have an impact. When people, I will say this, when people enter into the profession, they may not initially see how that previous background could be a part of their future career, but then later down the road, that does happen. For example, horseback riding as an example of that. Someone, and I do know someone who started a whole research portfolio around the workforce that works with race horses. So bringing in occupational health nursing into that experience really can be a blend. And that may not always, the blend may not always happen, but it can. And that's what's exciting about it. So yes, please come to the profession with that wonderful history and background.
Awesome, thank you. All right, same question for our friends at Notre Dame OT. Peter, can you really have any major and pursue this pathway?
Yeah, absolutely. I had mentioned before, we welcome students with any bachelor's degree, in terms of major, as long as they've met the prerequisites and they have the clinical hours and all that good stuff is taken care of. And much like some of my other colleagues on the call, we really value a diversity of different majors because that just brings different experiences and viewpoints. And at the end of the day, it ultimately serves, the patients, better to have those varied backgrounds and experiences. So 100% yes.
All right, thank you. And from Case Western with the anesthesiologist assistant program, Lizzie, is it really okay to have any major and pursue this pathway?
Yes, it is. Again, similar to all of our colleagues here, we value diversity, but we also have a lot of people who have very different backgrounds. We have a student who was a psychology major. We also have career switchers, so people who maybe started in a different career and have chosen now later in life to join the program. Again, as many of our colleagues have said too, we also have our prerequisites. So as long as you've filled those prereqs and if you are an older student, you might have to go back and do those prerequisites, but as long as they're completed, you're more than welcome to apply to the program.
All right, thank you. And last but not least, representing our PA program, either Karen or Shawnee, the question is the same for you. Is it really okay to have any major and pursue this pathway?
Sure, and thanks. It's a great question. It's one I get asked all the time, and they're really quite surprised. The answer is absolutely. As long as the applicant has a bachelor's degree, the major doesn't matter. You just need to meet all of the admission requirements. I mean, I've seen accepted students who were artists and photographers and have business and journalism majors or educational degrees. Like Lizzie, we had a career change. We accepted someone who had graduated with their secondary education degree and was teaching high school math, and then successfully graduated from the program and practiced for several years, and now is back in education as a PA faculty member. So, the answer to the question is absolutely.
So thank you all so much for confirming what I've been telling students all along, but of course it's much more impactful to hear it from you. And I'm so glad this is being recorded because when our students come in my office, I would love to just hit play and let them know, yes, it is okay to have any major. So I'm going to share my screen so that you can see instructions for the breakout room. because that's what we're going to go to next. And for our students, if you'll just sit tight, you will have an opportunity to speak with the panelists directly and ask them any questions that you have, and you'll have the opportunity to go into different rooms and, you know, find out whatever you want with these panelists. And we want to thank our panelists so much for their time. So I've shared my screen so you can see the instructions about the breakout rooms. And I believe Amber, our tech support, is getting that all set up.
Actually,
that
Erica,
correct?
if you want to go ahead and go into presentation mode to make that even bigger for people who might have small computer
Oh,
screens,
yes.
that would be
Sorry about that.
great. So I will launch these breakouts here in just 1 second, but let's go through the instructions real quick first. Here in this moment, you'll be able to click on the participant panel if you don't already have it open. And at the top of the panel, you'll be able to say show all breakout sessions. When you do that, it's going to show you, if you go to number 2, all of those sessions that you'll be able to join. During the sessions, turn on that camera if you'd like, unmute, of course, ask your questions. Everybody's eager to speak with you. You can, while you're in those sessions, feel free to move between sessions as well. I know lots of you marked that you're interested in multiple topics, so definitely bounce around between sessions as you get your answers to your questions. To do that, when you're in your breakout room, you'll see that bottom right image in this little screen here that's being shared. On the right, all the way at the top, there is an option to show other breakout sessions. When you do that, it'll give you the exact same screen again to just join another session, or you can click the little red door, pop back out to the main session, and move on in. If anybody has any problems joining sessions here in a moment, let me know. I'm happy to manually move people into sessions as well, but it should be pretty well straightforward. Speakers, you guys will automatically be in your room, so it should move you right in. If for some reason it doesn't, you'll just follow these same instructions. Okay, so I'm going to start these sessions. Now that they're started, you'll see in the participant panel the ability to join the session of your choosing. So go ahead and do that as you see fit here. So I'm seeing lots of people moving on into their sessions. So there's still some students hanging out with us. Feel free to unmute and ask a question if you have a question. You can also put something in chat if you need some help as well. Again, I'm happy to move anybody manually if you need. It's looking like everybody's moving themselves in, no problem. Very good. Okay, Bianca, let me help you. All right. So if you'd like, Bianca, you can just tell me in the chat there which session you'd like, and I'm happy to just move you on over. The session with the rep from Case Western. And now, of course, I'm immediately blanking on which Case Western.
Lizzie.
Case Western was.
Lizzie Pikush.
Yes, that's anesthesiology.
Yes,
All right.
anesthesia.
So let me move you on over there, Bianca. And then when you're finished, if you need help getting into another session, just hit that little red door and it'll bring you right back to me and I can help you again. All right, she has moved on over. Okay. So it looks like we might have one student still in here. Is that the Kane-at? I don't know if that's Kane-at, like the last name. Is that a student? Do you know, Erica?
That would be a student, but Kenat, where would you like to go?
I say feel free to unmute or put in chat, whatever your preference is.
Yeah, right now you're muted. Perhaps they just had to step away or something.
Yeah, they might be away from their computer.
Yeah.
And Rena, I see you're back in here. If you need some help moving into another session, just let me know. You can unmute or post in chat. All right.
I'll have the ability to hop around to the various rooms too, correct?
Yeah,
Andrew?
absolutely. You could probably stop sharing your screen at this point if you'd like, Erica. And then if you click on the breakout sessions at the top of your participant panel, you should be able to see all your
Yep, I
sessions.
see.
Does it also show you how many people are in each?
So like one of one, does that just mean it's just the person, like the rep?
Um, I don't really know. My screen looks a little different than yours. Do you have a little drop-down carrot where you can expand it and show all the people that are in there?
Oh, okay. That would probably
That
help.
might
Yeah,
make more,
so like,
yeah.
right, yeah. So when it's one of one, it just is the rep right now by themselves.
Okay. Yeah. So yeah, it looks like physical therapy is currently just the rep.
We
Um,
have
same
6
with
in
pharmacy.
nursing. We
Mhm.
have we have another person in anesthesiologist, and then we have 2 students in PT. No, it must be 3 students. I mean PA. 3 students in PA.
Yeah, yeah, because Karen and Shawnee are in there, which makes it 5. Yep. So yeah, feel free to bounce around as much as you like. I'll hang out here in the main space, Erica. So do you want me to stop the recording at this point or?
Oh, yeah, I guess that makes sense.
Okay. And you can always trim off this end from the recording if you would like as
Okay.
well.
Yeah.